Back pain during pregnancy is very common. In most cases, it is related to weight gain, hormonal changes, ligaments that are relaxed, poor sleep quality, or anxiety due to the big life changes that are about to happen in your life. There are many things that you can do at home to ease your back pain during pregnancy. Today, I will show you simple activity modification and exercises that you can practice at home. I'll also let you know when you should go to see your doctor because there might be something more serious going on. So let's talk about back pain during pregnancy today. Before I continue, let me remind you that this video is not intended to provide medical advice. It is for educational purposes only. If you have a medical condition that requires treatment, please talk to your doctor to get a treatment plan for you. And if there is an emergency, please go to the nearest emergency department or call an ambulance. There are some symptoms that your back pain can be a sign of a serious condition. If your back pain is accompanied by vaginal bleeding, that might be a sign of preterm labor. If you have fever or burning sensation when passing urine, it might be a urinary tract infection. If you have tried home-based remedies, posture and exercises, and your back pain is getting worse, then go to your doctor as you may need a painkiller like acetaminophen. Here are some precautions with using medications for pain during pregnancy. Do not use non-steroidal anti-inflammatory drugs or NSAIDs during pregnancy. Some of them are related to birth defects or premature labor. Avoid opioids during pregnancy. They may predispose the newborn to neonatal abstinence syndrome. What you can do to relieve your back pain during pregnancy? The first thing is to reduce your anxiety levels around the pain itself. We know that pain is an alert in our brain that there is some danger in our body. This is usually true if there is a fractured bone, a heart attack, or an infection. But during pregnancy, these pain signals are not really helpful. The body is not at danger. Pregnancy is not a disease that needs to be treated. So the brain might be giving you signals of danger, but in this case, hurt does not mean harm. Just by thinking differently about your pain, telling your brain that these sensations are normal, expected, and they will eventually stop, that's enough for your brain to stop these danger signals, and the pain will decrease in intensity and duration. Try some breathing techniques to relax. And see my other videos about square breathing and vagus nerve exercises. You may do these exercises as a preventive measure or to try to reduce the pain when it's hurting. Another technique is to try to get your mind away from pain. Use distraction, music, watch a movie, talk to a friend, go for a walk, prepare the baby's nest, and do some crafts. When the brain is distracted with other meaningful activities, it does not get too anxious with the pain itself. Do not rest too much. Try to be as active as possible. And when lying down, it is better to lie on your side. Avoid high heels or flats. Use a medium or low heel shoes. When the pain is very intense, try a warm water bath. Do not put the temperature too hot, as your blood pressure may drop too fast. Go for a massage session. You may also try acupuncture or spinal manipulations. Try an ice pack or a hot pack to your lower back area. You may buy a lower back support, especially if you spend too much time in the car. Do you like this video so far? If yes, give a thumbs up here and don't forget to subscribe to this channel. If you are interested in home-based exercise here is a list of excellent exercises for you to do at home. For warm-up, you can use a stationary bike or a treadmill. You may also put some music and dance for a few minutes. If you are on your first trimester, do these exercises on the floor. Pelvic tilt, cat-cow, bird dog, dead bug, planks, front and side planks, and side lying leg raises. If you are on the second or third trimester, avoid exercise lying flat on your back because the uterus will put pressure on the inferior vena cava, and this may impede the venous blood to reach your heart. Then you may feel dizzy, lightheaded, and short of breath. If you are on the second or third trimester, you may do sitting or standing exercises like pelvic tilt on the wall, squats, lunges, side bending to stretch the quadratus lumborum muscles, and rotation to stretch the multifidus and rotators muscles. Aquatherapy and hydrogymnastics are excellent options for exercises during pregnancy. Well, if you know a pregnant woman, send this video to her using this share button here. I created a handout that summarizes all of these exercises, and you can download all of them for free. Go to my website, www.drandreafurlan.com/pregnancy. When home-based exercises are not possible or are not helping to reduce the pain, it is advisable the woman to go see a physiotherapist. These professionals are trained to examine, make the diagnosis, and treat low back pain during pregnancy. Some conditions cause pain during pregnancy and they need a specific treatment. Like myalgia paresthetica is a compression of the lateral femoral cutaneous nerve here, and it causes burning thigh on the side of the thigh. Check my other video about this. Coccydynia is pain in the buttock area caused by a problem in the tailbone. In this case, there might need to be an injection or manipulation of the tailbone to alleviate the pain. Check my other video about coccydynia. Lumbar disc herniation may occur during pregnancy, and in complicated cases, it may cause cauda-equina. When there is cauda-equina, the woman loses sensation in the perineal area and has incontinence of bowel and bladder. This is an emergency situation, and she needs to go to emergency department. There might be laxity of the pelvic ligaments. This is normal during pregnancy because the body is getting ready to labor. However, when the sacroiliac ligament gets too laxed, that might be movement between the bones of the sacrum and iliac bone and cause pain there. The pain may radiate to the groin and hip. A woman with previous back pain problems may have her symptoms aggravated during pregnancy. In this case, she might need to continue the same treatments she was receiving before pregnancy. It is important to check with the doctor if they are safe for the baby. So I hope you enjoyed this video, and here are other videos from my channel that you can watch. See you next time. Goodbye.